today will all have the same message for the federal government. Now is the time to act and increase the Canada Health Transfer.
We need to address this issue now.
In this upcoming budget, in the COVID context, when health matters more than ever.
It shouldn't take a pandemic to get the attention of the federal government on this important topic.
Canadians don't need a banker, we need a partner.
It's time for the Prime Minister to step up, to work with the provinces and become a true funding partner.
If this is not the time to talk about healthcare, when would that be?
In case you didn't get that, the Premier's presented a united message today calling for an increase in federal healthcare funding from about 22% up to 35%. So is Ottawa listening? Is now the time for that conversation? It's Thursday. I'm here with that issue. It's the time for that conversation here anyway. Chantal Hébert, Andrew Coyne, and Althea Raj. This is not the first time, Althea, that we have seen the Premiers make this call, but it did feel like a bit of a pile-on today because it was heavily coordinated and choreographed. How do you think that message was received?
Well, it was not welcomed, but it wasn't surprising either. The Prime Minister's point of view has not changed. The Premier's point of view has not changed. I mean, this is a story where they're both actually kind of right. And the Premiers are trying to put pressure on two fronts. One, they are hoping that this is going to be in the budget. It's probably not going to be in the budget, as the Prime Minister has suggested, because he said, I want to deal with COVID first, and we'll talk about healthcare transfers after. But the key point is that they want unconditional transfers, and Ottawa wants conditional transfers. And it was pretty funny, actually, listening to this press conference and watching Jason Kenney twist himself into a pretzel, saying that, you know, when the Conservatives were in power, well, the provinces were overspending on healthcare, but now that he's a provincial premier, you know, everything is not at all the same. The provinces have tightened their belt, and Ottawa really needs to pony up more money. In some ways, Ottawa, it's true, you know, they signed a deal. This was supposed to be 50-50. Ottawa doesn't agree with the 78-22% that they're only funding 22 cents on the dollar. But it's clear that this is either going to be something that Ottawa needs to deal with as a government, or it's something that's going to happen during the campaign, because the provincial premiers have also said that they plan to make this an election issue.
Chantal, I mean, I do see the federal government's point. Like, this seems like it seems like the wrong time to start this negotiation, but at the same time, it's what a lot of Canadians are thinking about, is the state of our healthcare system too.
Yes, but as Althea says, it cuts both ways. For one, how many conversations did Stephen Harper have with the premiers when he was in power over how much he was going to transfer for healthcare? The short answer is zero. So let's settle that there. Second, how successful were the premiers, or most premiers, the last time they brought an issue in an election campaign? That would be a year and a half ago, and it would be called the carbon tax. And here we are today. So, yes, the Canadians are concerned about funding for healthcare. They usually are. But they are also concerned about what they saw in long-term care, which is Justin Trudeau's entry into the conversation. So it might well be that if the premiers want to achieve some measure of success on an increase in health transfers, and I'm not saying they don't have a case, except I've heard that case for 20 years, and I've not noticed that it impacted on election outcomes. But if they want it, they might want to start the conversation on something other than send us money.
Yeah. Andrew, what did you make of their plea and how it's, well, I mean, it really hasn't been well received because nothing's happened since the first time they made it.
Or the 100th time they made it. Yeah, I mean, the one thing the premiers can ever agree on is more money from Ottawa. And let's be clear, it's more money. It's not more money for health care. The dollars don't have little labels attached to them. They can spend them any way they see fit. You can make a coherent argument. It's contentious, but you can at least make a coherent argument for conditional transfers. If Ottawa wants or needs or deserves some role in impinging on provincial imperatives with healthcare, then it's perfectly entitled to attach conditions, and the provinces can take it or leave it. There's no, as I say, you can disagree with that if you like, but there's not even any coherence to the argument for unconditional transfers. This is the problem we have in this country, is that we have a healthcare system where you really can't know who's responsible for spending and who's responsible for results. It just allows each level of government to point the finger at each other interminably. Where the provinces have a case is in the long run. In the long run, we are facing an aging population. Most of the costs of that are going to be for healthcare. Most of that is going to be on the provinces. That's a strong argument for transferring tax room to the provinces, not just transferring dollars, but giving them tax responsibility, which is money they then raise from their publics and have to be responsible to their electorates for how it's spent. That's the long-term solution to this. Simply shoveling more money that's in the form of cash transfers, it just means more of the same endless game of finger pointing, and it's not helpful, and it should not be a priority at this moment when the federal government is juggling every other ball it can think of.
Sorry, Althea, you went in there?
Yeah. I don't know that that's fair. I think most Canadians who interact with the healthcare services sector feel that there is a great need. The problem, and I think Andrew alluded to this, is that while Quebec might want help funding the 8,000 new posts that it's created this year in the long run, you have Jason Kenney, who actually is making the Prime Minister's argument for him by not being there, by saying, well, we cut taxes this year and we intend to do that again because that's where our focus is. Well, Ottawa doesn't want to send more money if instead of investing it in the healthcare sector, you're going to be using it to cut taxes.
Yes, yeah, exactly.
Well, there's still an issue, if we're going to get into it, that we're not even close to knowing whether we're getting a proper bang for a buck from the amount that we're spending now in the healthcare system. The system is still largely unreformed. Mostly it's unreformed because anytime there's pressure to reform it, Ottawa comes along with more money.
Chantal, last point on that.
I'll just go to messaging. If you keep doing the same thing and it brings the same outcome, in this case, nothing, and no sign that you're really mobilizing public opinion, you're probably in need of a different strategy. And repeating it, I heard my premier, who was speaking for all provinces, say all he will look at in the next budget, or the test of the next budget for him, will be the line on whether healthcare transfers increase. François Legault is good. He's a populist. He knows how people work. I can't believe that he really thinks that most voters in Quebec or elsewhere will look at the next budget and say, oh, gee, it doesn't increase from 22% to 35%, so it's a bad budget. That is not how life works.
I don't have a lot of time, but obviously they're doing this too because they see the amount of money the government is shoveling out right now in terms of the government's pandemic spending. And there were some questions this week about whether it's been, quote unquote, too much. Here's what Chrystia Freeland had to say about that.
I've been surprised to read some commentary suggesting that Canadians may be doing too well for their own good. Some have pointed to rising household disposable incomes in the first 9 months of last year as evidence that our government acted too swiftly and too effectively to support Canadians. I disagree.
Andrew, what did you make of her defense there, or the criticism itself that the government, by extending support systems into June now, is being, quote unquote, too helpful?
Well, the specific criticism is they've given people way more money than actually was required in terms of their lost wages and income. The point of this was to keep people whole. They've gone way more than keeping people whole. Without the transfers, disposable incomes would have been down about 4%. With them, they're up 17%. So they're giving people way more than was actually required, which would be fine if money were free. If you're having to borrow that money, even at low interest rates, low for a time, then that becomes a different matter. You can say, look, it was a crisis situation, it was an emergency, no one had time to get everything fixed around. That's fine. But if you're looking forward and you're now talking about layering on another $100 billion in stimulus on top of the money that's already been tucked away in people's savings accounts, just waiting to be spent, then I think you say, okay, you've got to start. It may have been a forgivable mistake in the short run, But in the long run, how are you going to react to that? Are you going to just layer more money on top of that, or are you going to start to pull it back?
Okay, don't have long. Chantal.
For one, I didn't hear any premier complain about Ottawa being too generous. Just setting that aside. And second, I am uncomfortable about doing the macro analysis of this, thinking about people in low-income jobs who have woken up the next morning with 0 jobs and saying, oh, they all got too much money, so I'm going to stay away from this.
Althea, last word to you.
Yeah, I agree with that. I think it's important to note that we're talking about in the aggregate, whereas some people got a lot of money that probably did not lose any income at all. And you have people, like I'm thinking about 15-year-olds who got CERB, and you have people who lost all of their income and they were barely just getting by. And so she was trying to recast the issue because the government, frankly, deserves to be criticized for some of the programs that were ill thought out. Why would you give thousands of dollars to teenagers who live with their parents? That did not make sense.
All right, let's move on to talk about the politics of bailouts. We are learning this week that the federal government is inching closer to a deal with the airlines for a bailout package. It could be worth anywhere between $7 and $9 billion. Chantal, Andrew, and Althea back for another round on this. Now, we have seen governments in the past, in 2008, come in and bail out the auto sector, but the situation seems pretty different, given that airlines aren't completely bankrupt here, and sort of their purpose, I guess, in the country. What would be the danger, or is there a danger in supporting the airline industry? Or is it an absolute thing that the government is going to have to do to make sure they survive? Andrew, do you want to go first?
It's a bit of all of those things. There's no doubt that the pandemic has hit everybody, but it's hit some sectors particularly hard. And obviously, you don't want to hold a pandemic against an industry or a company. It's not their fault. At the same time, whenever you're having these mass bailouts, you're going to have companies that are going to get under the wire to get the bailout who might have been in trouble without the pandemic, which arguably includes Air Canada. So do you want to reward people for bad business practices merely because there happens to be a pandemic on? Separating out the two is certainly very difficult. But you compound that once the government has basically assumed responsibility for everybody, when it's basically said, we're going to bail out everybody and everything, how do you say no to anybody? When you've decided it's not Air Canada's responsibility, but your responsibility, then Air Canada is in a very strong bargaining position, and Air Canada's unions are in a very strong bargaining position because you can make the feds out into the bad guy. So this is the wages, I think, of the feds having sort of said, we've abolished scarcity and money is we can borrow basically for free, and there's no longer a budget constraint. It makes it very hard to say no to anybody.
Except it's not as though there's like a million airline companies in Canada, right? I mean, if the federal government allows it to collapse, like what is the solution then? I mean, you can sort of see that there's a different pressure on the government. I don't know, Chantal?
There is no scenario where the government allows the company to disappear. But you talked about the auto bailout. Yes, the auto bailout did not happen at the point where I'd ordered the car and paid for it and did not get my car and did not get my money back. And that's been a big point of contention. The notion that people who had bought tickets in good faith, usually hard-earned money, were suddenly told you have a credit for who knows when. So the refund issue has been a big issue. The other thing has been Air Canada's approach to getting money from the government, which it is true other governments elsewhere in the world have extended to their airlines. But the Air Canada approach has been the knife on the throat approach. We're cutting routes. We're not going to be serving this place or that place. And I have to say that whoever is advising Air Canada, since we need to name names, probably does not understand government and political parties, i.e. you need to build some consensus and public support before you extend public money. And if you are building bad will or ill will amongst voters, you are going to make the government incapable of extending the hand that you are asking for.
Which may be why which may be why we learned this week that Air Canada was willing to give some of those rebates back. Maybe they've realized that is a necessary play for them. Althea, your thoughts on this?
Yeah, I would say it's not just Air Canada that has been driving a very hard bargain. It is also WestJet. And things, at least from Ottawa's perspective, is that the reason it's taken so long to get an agreement with the airlines is really the airlines' fault. I think what has really crystallized things, frankly, is the Liberal government's clamp down on international travel in the last few weeks. That has really brought it seems the airlines back to the table in a way that they had not been for months, frankly. So, what can you mention the auto bailout? Who knows? Maybe we'll see something similar with equity or something. I mean, I agree with that. I cannot imagine any government that would let at least Air Canada fail. Like, you cannot let the national airline fail. And you also have a responsibility as a government to connect parts of the country together. So you can't imagine that the government would agree to any sort of deal, whether it's loan, whether it's equity, whether it's grants, that would present a situation where regional airlines are not returned. And of course, we've also heard from Unifor that what's really important for them is that the airlines actually rehire their personnel. So that's obviously something else that's going to be on the table.
I think Andrew wants to make one more comment, and then I got to go.
Well, just that Air Canada is not the only possible airline that could transport people from place to place within Canada. If push came to shove, there would be other solutions, other ways of restructuring things under a different name or a different airline, whatever. So the notion that Air Canada is too big to fail, I think, is, again, that gets you in a position where you basically just deliver on whatever they demand.
Okay, got to leave it there. Thanks, everybody.